The majority of perianal abscesses arise from a small gland that lies around the anal canal. Those small glands can become blocked, and that can allow infection to develop. If infection develops, fluid can accumulate, which causes an abscess around the anus itself. If that fluid drains out through the outside skin, a tunnel or fistula can develop. A fistula would arise then from the inside opening of the anal canal and extend to the outside skin. Signs and symptoms of an abscess include redness, tenderness, or swelling or mass around the anus itself. Signs and symptoms of a fistula can include similar symptoms of pain and swelling around the anus itself, or persistent drainage from a small little hole around the anus. The majority of perianal abscesses and fistulas can be diagnosed clinically, which means we can often tell just by looking on exam. Sometimes imaging tests such as CAT scans, MRIs, or ultrasounds may be helpful if a diagnosis is unclear. Rarely, patients might need to go to the operating room for an exploration to determine if a fistula is present. The majority of perianal abscesses can be treated by drainage either in the clinic or in the office. Rarely, if the infection is large, a trip to the operating room may be necessary. Simple perianal abscesses, when drained, typically resolve and don't require further treatment. Recurring perianal abscesses in the same spot over the course of months or years may indicate the presence of a fistula. After an abscess is drained, about half of these will go on to become a fistula. Treatment for a fistula can be tricky. Small, short fistula tracts that are close to the outside of the anal canal could be treated with a simple procedure like fistulotomy, or removing the roof of the fistula tunnel. Complicated fistula tracts, or those that go up higher inside the anal canal, may require more complex procedures or a series of staged operations. Colon and rectal surgeons are experts in the surgical and non-surgical treatment of diseases of the colon, rectum, and anus. They have completed advanced surgical training in the treatment of these diseases, as well as full general surgical training. Board-certified colon and rectal surgeons complete residencies in general surgery and colon and rectal surgery and pass intensive examinations conducted by the American Board of Surgery and the American Board of Colon and Rectal Surgery. They are well versed in the treatment of both benign and malignant diseases of the colon, rectum, and anus, and are able to perform routine screening examinations and surgically treat conditions if indicated to do so.